Henry Archibong, representing the people of Itu, Ibiono Federal Constituency in Akwa Ibom State. Mr. Speaker, I want to support this bill for the simple reason that it is trying to strengthen the National Health Act. Mr. Speaker, I see this amendment as a very microscopic aspect of the National Health Act. The question is, here we are berating doctors that they are not performing well, they cannot diagnose. Here we are saying that our people who walk into the clinic and they don't get treated. It's very, very sad and it's very emotional. But it will also interest us to know that our people, high-profile Nigerians, have also walked into clinics in Europe and come back dead. But the issue, Mr. Speaker, is this: how much of the Health Act is being implemented? If we implement the Health Act, then people will naturally not go out of this country to seek medical treatment abroad. For instance, we are expected to provide 15% of the annual budget to fund health in this country. But so far, we've been having less than 5%. We are also aware that we are supposed to also be deducting 1%, I think, from the Consolidated Revenue Fund to also add to fund health. That has not been done. If that were to have been done, we would have had enough facilities. For instance, somebody brought a motion here sometime that said that we got to discover that it is only one X-ray, one radiotherapy machine that functions in this country. So if you have people that are queuing up for radiotherapy that have cancer and they cannot get access to such facility, what do? They have to move. Mr. Speaker, in implementing the National Health Act, a lot of issues are going to be addressed. Now, let me point out to my colleagues, honorable colleagues in this House. Some days ago, we tried to bring a motion to investigate the accounting procedures in the teaching hospital. Mr. Speaker, I brought that with the simple reason that I have also had an experience after working in the teaching hospital. I want to say that the corruption that is even happening in the teaching hospital is so astronomical that it might even surpass this. For instance, when people come for treatment, say in the hospital, bills are made. Bills are not made by doctors, bills are made by the accountants. Somebody can be given a bill of say, 120,000. And by the time the person goes to pay the bill, Mr. Speaker, this is what happens. They tell you, madam, if you do not, or madam or oga, if you cannot pay 120,000, give us 60,000. We will destroy the folder. Mr. Speaker, I stand here to tell you that that is what happens in the teaching hospital. By the time you don't get to pay your 120,000 naira, for instance, and you're paying only 20,000, and somebody pockets that money, the next time you come for your follow-up treatment, the card has disappeared. So that is also one aspect that has to be corrected, not only that people should be regulated from traveling abroad, even though it is not a good thing to do. But if the National Health Act is implemented, a lot of control, just like he has stated here in his objective. The objective of this amendment, he has listed a lot of them here, Mr. Speaker. The objective of this amendment is the objectives that are found in the National Health Act. So, Mr. Speaker, I want to say that we have to do the right thing, because what we are suffering in Nigeria today in terms of inability of Nigerians to get good medical treatment in this country is because of our inactions. It is because of the inactions of the leaders. The other day I brought a motion about the presidential villa clinic. It's so sad that even the presidential villa clinic cannot, be able to cater for the president of this country. So, like the First Lady had said, how much more the poor Nigerians? So, Mr. Speaker, I want to support the presenter of this bill, and also to say that probably by the time it passes to second reading, we'll be able to look at the fact that I think in Section 6 of that National Health Act, there's a provision for regulation of these foreign medical treatment abroad. So that can be strengthened. I support, Mr. Speaker, the presenter of this bill. Thank you, Mr. Speaker.